7 designer silica mesh that acts as a matrix, if you will, a structure, sort of like a gauze, a medical gauze. And that allows ingredients to bind. Therefore, with the 7 designer silica mesh, it is air permeable, meaning there is airflow allowing to the skin. Because it's air permeable, you can fairly say wearing nothing at all, you get ambient air to the skin, right? So we added what's called CeraVite, and CeraVite is our patent. And CeraVite is a live yeast cell derivative, a peptide complex. And what its function, what it does, it allows oxygen uptake to the skin cells via osmosis. I assure you there's 0 oxygen in our product. If there were, it most likely would be a hydrogen peroxide, and then of course everybody would have a bad day at the office, right? It would be tragic for everyone. So it's CeraVite that allows the oxygen to the skin cells. You can apply Oxygenetix immediately following most procedures. Short of the skin weeping, oozing, and bleeding, and we're not talking microneedling or the dermal roller, that's no problem. I'm specifically talking about where the skin's exposed and raw. Oxygenetix has really become the standard in post-recovery topical. Doctors, let me give you an analogy. This is a good one. Imagine us in this room, no windows, no doors. In this room, no ventilation, right? No airflow, and we have bacteria in the room. The bacteria will remain in the room because of 0 ventilation. Well, that is what we are essentially doing every day when we put makeup on or using a product that is made of water and oil because of preservatives. We are now diminishing airflow. So Oxygenetix really is the one that opens those big windows and opens those big doors, allowing oxygen coming through. So, of course, this room is our skin, and then Oxygenetix is opening that door, going. The moisturizer specifically has been the hero product with laser patients, rosacea patients, and acne patients. And I'm going to put some moisturizer on your hand, and before you smooth it over, wait 2 or 3 seconds, and then when you do, you'll notice a slight cooling sensation, or the moisturizer being cooler. It's not like you're going into a freezer and you feel it like, chill, but you will feel a slight cooling and calming sensation. So just give it 2 or 3 seconds, and then go ahead and smooth it on over. I'm sorry, I just like everyone to participate. I know. Pretty soon you guys are going to have the softest hands in all of Mexico by the end of the day, okay? So did you notice immediately, like there's just a slight cooling sensation? So that alone immediately calms and soothes the laser and rosacea patients. Immediately they start to feel the effect. And it really relieves that tension. You know when you get out of the shower and you don't have any moisturizer on and your face is kind of like tight and dry? Well, that's how these patients are feeling. So when you apply Oxygenetix moisturizer on, you relieve that tension. And I'm not just talking visually. I mean, not even visually or physically, but also emotionally. Right? Because it's a lot of and not only for the patient, but for the physician. It's like there's a lot of tension in the room. You want to make sure your patient is feeling good, that there is no extreme pain. So everyone's feeling the tension. Well, Oxygenetix relieves that not only for the patient, but for the staff as well. Okay? Now, for the acne patients, as I mentioned earlier, the analogy of the room. And most people think that moisturizer for acne patients is a big, red sign saying do not apply. And this is not your typical moisturizer. Remember, we're not made with water, we're not made with oil, we're not made with preservatives. And those are the very things that that increase acne breakouts. We work synergistically with your acneic treatment series. Because of the oxygen uptake, it's accelerating the healing for the acne. So for the first time now, rosacea patients can wear a moisturizer without feeling irritated or getting inflamed, an accelerated inflammation. And the acne patients can now hydrate, and with the PCA and the hyaluronic that's in the moisturizer, you're now able to balance the pH, because let's face it, when you have acne patients, they're completely way off. They're trying to dry out their skin because of the excess oil production. Oxygenetix is now going to be their best friend, and it's really going to be very complementary to your services. The foundation is really the camouflage part of the process. It has an SPF 25. It's a titanium physical, and the pigment is very highly pigmented, actually, and so a very little. Hello.
Hola.
Hello.